Hello, Partnering for Vaccine Equity, learning community members, members of NIH SEAL, and others working on vaccine equity. And welcome to this afternoon's learning event. My name is Kristen Brown, and I am the Deputy Director for Group Learning. And on behalf of our team at the Urban Institute, thanks for joining us. Today, we will learn about booster science and messaging. We have been hearing a lot in the news about the importance of boosters, and there have been questions within the learning community about how boosters work, who should get boosters and when, and how to communicate the importance of boosters to our communities. Before we go further, I'll do our typical quick review of how this session will work. You've all been muted upon entry to the session. There are a lot of us, so staying on mute unless you're speaking is key to keeping the discussion going without accidental interruption. You do have the opportunity to speak your question rather than type it into Q&A. It's your choice. If you want to speak your question, use the raise hand feature at the end of the presentation and we will unmute you. If you want to type your question, use the Q&A tab to do this, and you can ask a question at any point during the session. The chat room feature is also open today, and we encourage you to chat amongst yourselves as you'd like, but please use good chat room etiquette. By this, I mean, do not post questions for the speakers in the chat because we might not see them there. And although this probably goes without saying, please be civil to one another and to our speaker while chatting. We have begun offering live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. Finally, as with all of our learning events, we will post the slides and a recording of this event on our community website and circulate them through the digest that go out through the CDC-managed Adult Vax Program listserv, which all program members should be a part of. If you have technical difficulties at any point during the session, send an email to our community manager's inbox at vaxequitylearning@urban.org. We'll be watching the inbox and we'll try to help you as quickly as we can. And now it is my pleasure to introduce our featured speaker. Dr. Wiley is an associate professor of medicine in the Division of Infectious Diseases at Emory University and the director of antimicrobial stewardship at Emory University Hospital Midtown. She is a member of the Emory Department of Medicine's Diversity, Equity, and Inclusion Council and serves as the physician lead of the Emory Healthcare COVID-19 Treatment Guidance Committee. She is a co-investigator in the Emory Vaccine and Treatment Evaluation Unit and is the Atlanta Hope Clinic PI on the NIH Recover Long COVID study. Thank you, Dr. Wiley, for taking the time to speak with us this afternoon. And Dr. Wiley, I will hand things over to you now.
So thank you so much for that kind introduction, Kristen. And I just want to let everyone know that it is my absolute honor to speak with you all. Community engagement and anything related to the community is near and dear to my heart. So I want to start off by saying thank you so much for everything that you continue to do on a daily basis. So yes, we're going to talk about COVID-19 boosters, and we're going to talk about science and messaging, since most of you are doing the work in the community to pass the word on to our loved ones and colleagues and community. So next slide, please. So the goals of this talk. We will talk about the science behind how COVID-19 vaccines and, of course, the booster vaccines work. We're going to discuss current guidance around COVID-19 booster vaccines and give insight and tips on how to message about the boosters. Next slide, please. So first things first. You're going to run into a lot of people who, maybe they haven't received their vaccines yet. So who should get vaccinated against COVID-19? Most of us know, but this is a friendly reminder. So next slide, please. Short and sweet. Everyone aged 6 months or older should get vaccinated against COVID-19. I have been surprised by the number of people who are not aware that children are eligible for COVID vaccines. So, short and sweet, anyone age 6 months or older are eligible for COVID-19 vaccines. Next slide. So let's do some review and try to make this as simple as possible to spread to the community. What is the science behind how COVID-19 booster vaccines work? Okay, next slide. So what you see here in the middle is a cartoon of the COVID vaccine. So that's where you see SARS-CoV-2 virus. That is actually the COVID virus itself. So what you see here, these little red prongs are what we call the S protein. And the S protein is used by the virus to, attach to our cells in our body, okay, to cause disease. So what we want with any vaccine and with the boosters is to develop an antibody in response to a vaccine. So what you're saying here is if the virus goes into your body, the antibodies, which are kind of like your protection, I like to think about them as kind of our army, will come in and attach to the virus itself and kind of mitigate it and decrease replication, decrease growth of the virus. So big picture, what we want is an antibody response. So you develop antibodies, honestly, in two big ways. Either you develop them on your own body develops the antibody once our bodies are exposed to the virus. But the purpose of the vaccines is so you can develop an antibody response, develop your kind of protection without having to be exposed to the virus itself. And we circle here the S protein because our two available vaccines right now, Moderna, okay, and the Pfizer, are targeted against this S protein. Okay, next slide, please. So, and this is just another way to view this. So remember that spike protein, that red protein that's on top of the COVID virus. What the vaccines do is they deliver the genetic message which is messenger RNA that codes for the spike protein. So it's essentially, rather than saying, hey, body, here's your entire, the virus for you to respond to, these vaccines develop and deliver the genetic material specifically for that S protein. Then the vaccine, with the messenger RNA inside of it, is injected into your muscle. And what you see on the last picture is that the vaccine triggers the production of the spike protein. Remember, that's what you want your body to make. And thus your body develops the antibodies specific to that protein. So again, the yellow here is the spike protein. Our body develops antibodies against that protein. So the big takeaways from this slide is sometimes you'll hear someone say, I don't want you to inject the live virus into my body. These COVID vaccines do not contain live virus. What they contain is the material that codes for that red spike, that spike protein, so that your body develops antibodies specifically to it. Okay, next slide, please. So this is another pictorial, okay? I like to have just kind of basic pictures that make it easier to explain this to the community. So again, understanding that the virus causes COVID-19. And what you'll see here is, remember, we were just talking about the spike protein. So this green, the little green squiggly marks there, that is the messenger RNA, okay, which is the genetic material for that spike protein. And that is what is in the vaccine. So you see the little purple or kind of more pinkish area. What is in the vaccine? So in the vaccine is the messenger RNA, the genetic material that makes the S protein so that your body can make the antibodies. And now let's go all the way to the bottom. How does the vaccine work? What happens is within the syringe is that material that your body is going to use to make that the spike protein. And then the little purple Y-shaped areas, those are the antibodies. And that's what you want, to have antibodies that are there and waiting so that if or when you're exposed to the virus, then you already have, an army to kind of come in, your army of antibodies to fight off the COVID virus. It's really important. Some key points here is number one, there is no live virus within both the vaccines or the boosters. Number two, we're going to talk about this a little bit more as well, is since your body is making the antibodies, can you feel a little icky and, have low-grade fevers and have a sore arm and not feel the best the day or so after the vaccines? Absolutely. So as you're showing this to the community, sometimes seeing pictures like this is very, very helpful. So next, please. Also, it's very important that you all know that a lot of these materials are available in Spanish as well. So many of you know that we have had a disproportionate impact of COVID on many underrepresented minority communities, the Black community, the Hispanic community, the Latinx community, Native Americans, etc. So it is really important that the information that we're providing the community is information that we can all understand, that it is present in both English and Spanish, and that we're giving this information in a way that, irrespective of your education level, that you understand this. So these materials, I took these straight from the CDC's website, and those of you who are involved in NIH SIL, they have tons of resources online in English and in Spanish. Next slide, please. Okay, why is it important to get COVID-19 boosters? So I hear this all the time, every day. I've gotten 3 shots. I'm tired of this. Why do you want me to get more? So why is it important to get COVID-19 boosters? Next slide, please. So, what do you need to know about getting COVID-19 boosters? This first sentence here, COVID-19 vaccine boosters can enhance or restore protection that may have decreased over time. So these antibodies that I was just talking about that are being developed, I want you all to know that our bodies make these antibodies, but with time, you have decreasing amount of antibodies in your system. So it is important to get the boosters to build back your immunity. So that's what I tell people, is we want to make sure that they remain protected, and that they're protecting others. And also staying up to date with your COVID-19 vaccine. It provides the most protection from severe COVID illness and includes at least, we're going to get to this, 1 booster for everyone aged 5 years or older. So remember, vaccines are available, period, for everyone over the age of 6 months, and then boosters for everyone aged 5 years and older. Okay, next slide. So, what should you expect if someone says, hey, I've already gotten, 3 boosters, you're asking me to get my second, what should I expect after receiving a COVID-19 booster? Next slide. So what I like to tell people is to expect almost, likely what happened after you got your initial COVID-19 vaccine, that the COVID-19 shot can cause side effects in some people, not everyone. And typically these side effects goes away in a few days. Some of the most common side effects, and I had this myself, pain at the injection site. You can have some redness at the site and some swelling. And some people feel this in the remainder of their body as well. Some fevers, chills, they feel really tired, headache, muscle pain, nausea, all of that is common. And, when should you ask your healthcare provider or the facility staff for help? If this gets worse after 24 hours, the redness or the pain, if the side effects are really bothering you, or if they're not going away after a few days. But I also tell people, there are some people who get their vaccines or their boosters and they feel really, rough for a few days. So if they have the luxury of having the weekend off, what I say is consider getting your booster, on a Friday, since you'll have the weekend to recuperate. Drink a lot of water. As long as there's not a reason that you can't take acetaminophen, which is Tylenol, or like ibuprofen, which is Motrin, that can help with the symptoms as well. And I also tell people is I'd rather feel achy and not the best after getting a booster. And I say this because I've seen COVID and I've seen it up close and personal in the hospital. What you don't want is to avoid the booster because of these side effects and end up with COVID and get really sick or have to be admitted to the hospital. Next slide, please. So some other helpful tips, if someone in the community, says, hey, after the first few shots, if you have pain, headache, or fever, ask a healthcare provider or someone at the facility where you got the vaccine if you can take ibuprofen or acetaminophen or Tylenol. And apply a cool, wet washcloth over the area. That can help, especially if you have a lot of soreness. Use or move your arm gently. And if you have a fever, drink plenty of water, get plenty of rest, and dress lightly, just in case you feel sweaty. So all of these things are some things that you can tell the community members if they say, ugh, I didn't feel good after getting, the first shot, or if they've already gotten a booster and they're due for their next booster. Next slide, please. So now to get to who should get COVID vaccine boosters. So we've talked about who is eligible for COVID vaccines, period. That's anyone over the age of 6 months. Who should get boosters? We talked about that really briefly, starting at the age of 5. But next slide. So let's go through who should get the booster. And what I like to tell people is don't try to memorize this. Things change, but know how to go to the CDC's website and find out this information. So most children and teenagers, if they're 5 years old or older, can get are eligible to get one booster. So they're in first grade, they've gotten their initial series, they are eligible to get a booster. Most adults under 50 should get one booster. I am under the age of 50. I have already received my initial series and I received my one booster. Adults aged 50 or older, and a lot of people don't know this, so please spread this to the community, should receive 2 boosters. So I made sure that my mother and my stepfather and my grandmother have received their initial series, plus they are due for 2 boosters. And if someone has a weakened immune system, so if people over the ages of 12 who have a weakened immune system should also get 2 boosters. So this may be, a 13-year-old who has diabetes, a 50-year-old who is receiving chemotherapy for breast cancer should receive 2 boosters. Again, don't memorize this, but have this available. And I'm going to show you another resource that can easily, show you who should get a booster and the timing of getting the booster. Next slide, please. Okay, so this is a wonderful website in the CDC, and I'm not going to call that out, but it's here in the red box where you can click this box on find out when you can get your booster. And when you click it, it will ask you several questions. How old are you or the person? Do you have a suppressed immune system? Have you received your initial series? So there's, if you're walking around in the community and someone says, am I due for my booster? You can enter this information and it will tell you exactly when they are due to get their booster. Also, if you're interested and you want email updates sent to you, there is an area there where it says, hey, if you would like to receive email updates about COVID-19, enter your email address there, and they can push a lot of this information to you. So again, don't memorize anything. Know where you can go to find that out, because a lot of people in the community may ask you this question. Next slide, please. Okay, what about children and COVID-19 vaccines and boosters? So, we're all very protective about children and our young ones. And I'm not a pediatrician, but we receive a lot of questions from concerned parents about, should I get my child boosted? Should I even give allow my child to get an initial vaccine? So let's talk about this. Next slide. Okay, so some of the things that you should consider talking to, your community members is that COVID-19 vaccines can protect children, again, 6 months and older, from serious complications. COVID-19 vaccines help protect the health of children with underlying conditions like sickle cell, cystic fibrosis, diabetes, and that these vaccines prevent and help prevent severe illness and hospitalization in children and teens. A lot of the questions I get is, my kids, they haven't been vaccinated yet. They're fine. I'm not worried about it. But I do like to ensure that we tell people that these vaccines do not, eliminate the possibility of your child contracting COVID, but they do significantly decrease the likelihood of them getting really sick and being hospitalized. So of course, this is a personal decision that parents and legal guardians have to make, of course, by speaking with their pediatrician and their physicians. But these are some of the reasons that I share. I also like to say that, yes, your child may be very healthy, but they are going to school with other children who are not. So by vaccinating your child, you are helping to protect your child, but you're also helping to protect other children in their schools and in their community. Next slide, please. And getting him or her or they vaccinated against COVID-19, it means less worry and more play. So one of my colleagues is a Black woman, physician, doctor, OBGYN. And what I really loved about her is she was very vocal when she was pregnant with her child. She posted about getting her vaccine. She posted about getting her booster. Now her daughter is, I think, between 6 months and a year old, and she posted about getting her child vaccinated. So talk to your doctor, talk to your nurses in your family, talk to the community about the importance of vaccines. And safe and effective vaccines are available for everyone aged 6 months or older. Next slide, please. So how about, we talked briefly about this, how about COVID-19 vaccines and boosters for children with suppressed immune systems? Again, we're talking about children with diabetes, cancer, HIV, sickle cell, etc. Okay, next slide. Okay, so again, this is not to be memorized. So let's start at the bottom here. If the child is between 5 and 11 and they have a weakened immune system, they receive 3 doses of their initial series, dose 1, dose 2, and dose 3. That's their primary series. And then they're due for a booster, okay? So, and if they're between 12 and 17 with a weakened immune system, they receive that initial series plus dose 4 and 5, which are their boosters. This is very similar for adults with weakened immune systems. they receive, up to 5 doses. So I understand when people are like, this just seems like a lot. The primary reason for the 5 doses and the extra boosting, especially in those with suppressed immune systems, is these are the populations where if they develop COVID, they have worsened outcomes. They go to the hospital, they get really sick, they end up on life support, etc. Okay, again, don't memorize it, just know where to go to get the information. Next slide, please. Okay, so how about COVID-19 vaccines and boosters in pregnancy? So just like, we're really protective over children, people are really protective over their pregnancies and really thinking about, what is happening with their unborn child, understandably. Next slide. So what I tell people is, if you are pregnant, should you get vaccinated? Yes. If you are pregnant, should you get boosted? Yes. So tell, pregnant persons in the community, please, to stay up to date with their COVID-19 vaccines. And the reason why is most people who get very sick with COVID-19 during pregnancy are those who are not vaccinated. Working in the hospital, I can't tell you how many, people that we see who were worried, didn't get vaccinated, they developed COVID and then ended up in the hospital. And they were really sick, and of course their unborn child is really sick as well. Another benefit of this is these antibodies that you make when you're during the pregnancy goes over the placenta to the baby. So when the baby is born with antibodies, which is wonderful. And then once they're 6 months old, then they are eligible. Also, breastfeeding, using breast milk, you can pass on your protective antibodies to your newborn. Next slide, please. And, it's summertime, people are still saying, hey, I'm heading on vacation. Maybe I should wait until I get back from vacation and then get my booster because it's gonna, take me through the winter time. If they ask you, should we wait? Next slide. So the answer is, here's a nice little checklist for you. Get your passport, your sunscreen, your hat, your bug spray, and your COVID-19 booster. So, tell people, no, there's no need to wait. And I kind of feel like a lot of people are also like, oh, if I get the booster now, will I not be eligible for any updated booster that may include Omicron material later on? That's not the case. If you get your booster right now in July, if there's a new booster in the winter and early 2023, there's no reason that you will not be eligible for that one as well. So tell people, get your COVID-19 booster. Next slide, please. So tips on how to message, and I'm preaching to the choir here. No one's better in the community than you all are. So listen. That's what's helped me most over the past couple years. Don't judge. And sometimes you're not going to change someone's mind the first time. Plant the seed, listen, talk to them, and you'll be surprised. Sometimes you go back around and people will be open to getting the vaccine or the booster. Let them know that you're going to protect both yourself and your loved ones, so that by getting their COVID-19 vaccines, they are protecting themselves and their loved ones. Next, it's really important to speak in the language and at the educational level that is easiest for your community member to understand. Keep things simple, okay? Speak in the language that they understand. Share resources, links, and posts, that anything that will make that process easier to understand. Next slide. So why is the amazing work that you all are doing in the community so important? Next slide. So I'll tell you why it's important to me, and I'm sure why it's important to you as well, is family. So this is my family. I grew up in a rural community in South Alabama that, a lot of people are not rich, and our community is a rural community. A lot of people are blue collar workers, work in farms, factories, et cetera. So it is important for me to protect the people in my community and to protect my family. So my mother is up here in the right-hand corner. That's me in the little red jacket. I grew up in a single parent household, but grew up with tons of family. So the black and white picture at the bottom is me and my aunts and my cousins. And the picture in the middle of the three women, that's me, my mother, and my grandmother. So this work is so important to me, and I'm sure it's so important to you because of family. I want to protect my family. I want to protect my community. And I want all of us to be as safe as possible to make it through this pandemic. Next slide, please. You all are already out in the community doing awesome work and doing outreach. So this is, some of the work that we have participated in at Emory and at my community. We go to historically Black churches. We have given vaccines directly to people. The young man here all the way to the left is a medical student, and it really meant a lot to him to be able to be a Black man, given a Black woman and Black people in our community the vaccines, educating them about it. So we are teachers and medical students and physicians, and we go out to the community to do this outreach. And this is exactly what you all are doing as well. And we're really grateful. Next slide, please. And this is about life and death as well. So this is the Vital Statistics Surveillance Report. And this figure is looking at the change in life expectancy at birth by Hispanic origin and race and sex. And let's just look at, but we're comparing 2019 and 2020. And what you see on one axis is the change in years. We're talking about years of life. And then you have up top, non-Hispanic Black, Hispanic, male, non-Hispanic Black female, and the list goes on. So what you see here is that the life expectancy of a Black man between 2019 and 2020 decreased by 3 years. We're talking about lives lost and years lost. A Hispanic man between 2019 and 2020, the life expectancy has decreased by 2.4 years. So this isn't just about, oh, get your booster. This is about, we have to save lives. Next slide, please. And, we have lost over 1 million human lives in America. Black, white, Hispanic, children, parents, loved ones, teachers, et cetera. So this is why we're doing this work. Next slide. And that's the end of the official presentation. Thank you so much for your attention. And I am open to answer, any and all questions. And again, thanks so much for what you do in the community.
Thank you so much for that awesome presentation. The questions are coming in. The first question was, are the flyers that you use in the presentation available on the CDC website?
Great question. So a lot of those, and I'm happy to share what I have here, but if you go to CDC Instagram, they have tons of easy to understand images that you can retweet, re-Instagram, that's easy to follow. So if you're on Instagram, and literally you search CDC, that's where I got essentially all of these from. And a few of them from the CDC.gov website. If you go to COVID, and there is a place where it's medical professionals can go one place, and if you're looking for patient-facing material, you can go to another location.
Okay, thank you so much. So next question says, the pushback to the maintain your immunity case for more boosters is that we aren't fighting the same strain from 2020, that this isn't the alarmingly fatal disease it was. So why should we tell people to get boosted for something that really isn't going to impact them? just trying to view this from the perspective of the cynics.
Absolutely. So, and I'm glad you asked that question, because everyone asked that question. So, although we have new variants, and you're hearing a lot about BA4 and BA5, the misconception is that the current boosters and vaccines are ineffective against the newer variants. And that is not true. The most important thing is, in my opinion, what you don't want is someone to die and someone to end up in the hospital. And using the current boosters that we have available, even right now in the middle of BA5, are really effective in decreasing the likelihood of someone getting sick enough to have to go into the hospital. So are more people contracting COVID right now? Absolutely. Is BA5 contagious? Yes, it's the most contagious. However, I would rather contract COVID and know that I'm boosted and won't get sick enough to be in the hospital or die. So that's what you should tell them. And I don't think that we're getting the word out efficiently enough to say. Some people are thinking that these boosters don't work at all against the new variants, and that's not the case. But thank you so much for asking that question, because so many people do.
So we have a very similar question, saying that they also get a lot of questions. If it makes more sense just to wait, like is there until the new variant, to the new vaccine, just as the new variants comes out?
Great question. What I say is, is don't wait. And if someone says, well, why shouldn't I wait? I've already gotten, 2 doses plus the booster. I'll just wait until we get a fresh one. What I would say is, getting the booster again, remember those antibodies have decreased, and you want to have as many antibodies on board as possible. Going ahead and getting your booster right now will help protect you until you're able to get the updated booster. I also feel like people feel like, oh, we're going to have this updated booster really, really soon. So we know it's coming. I don't know the exact date, but if, let's say, we're talking about November or December, it's July right now. That's 5 months later. You go ahead and get your booster now, you will be eligible, likely, to go ahead and get another booster as well. So I'm not eligible for 2 boosters, but if I was today, right now, I would have my second booster. And another reason to tell people is, I am in my 40s and I am healthy. However, I go and take care of really sick people every day. I go and visit my grandmother who is in her 80s. I have, cousins who are sick. So I don't get vaccinated just to protect me. Getting boosted also helps you protect your loved ones. So tell people that as well.
That's an excellent point. So another question was, does a BMI over 30, so I guess being obese, qualify you for the second booster?
No, Eric, that's a fantastic question. No. Okay, so it's mostly over the age of 50, but I'm glad that you bring up obesity, because a lot of people are obese. To be honest with you, a lot of people in the United States are overweight or obese. So just being overweight or obese increases your likelihood of having bad outcomes from COVID, period. So if you're over 50, period, you should be getting the second booster. However, if you are overweight or obese over 50, that should increase your interest in getting it even more.
Thank you. Okay, so the next question is, for children 5 through 11, do they receive all 3 initial doses, or is it dependent upon the type of vaccine that they get? So do they get like 3 for Pfizer and 2 for Moderna, or how does that look?
Yes, yeah. So that's an excellent question as well. And what I always have to do is, so it does depend. And if someone is asking you that specific question and you don't have that information right on hand, what I recommend is either screenshotting, what I showed earlier, or looking it up on the CDC site. So, and also, you may not have access to everyone's other medical problems. So, a child with sickle cell, a child that may have HIV, and the family members or the loved ones don't want to disclose that. that's even more of a reason to kind of share that information to let them know where to go to get it. So to answer your question, yes, it does differ, but instead of trying to memorize it, have it available so that you can look it up and share that information.
So another community member asks, should people be encouraged to test for COVID before getting vaccinated or boosted? Does it matter if you had COVID and then get vaccinated?
Great question. So no, I don't encourage people to get tested before they get vaccinated. However, if you're sick, in these days, if you're sick with anything, so a lot of people are having what they feel like are sinus infections, or, one of my colleagues was just like, my nose just wouldn't stop running, and she thought it was allergies, and it was COVID. So if something feels off about your body, you feel achy, you don't feel yourself, your nose is running, you have some congestion, get tested, okay? And if you get tested and you're positive, wait until, you're feeling better to go ahead and get the vaccine. And we especially don't want you to get a vaccine or a booster while you're sick. But just to preemptively, like, hey, let me go get a test before I go get a booster, don't recommend that.
Okay. So from your perspective, how can we encourage parents to get kids to get vaccinated, to get their kids vaccinated?
That's hard, because I have friends and colleagues who say the same thing, like they'll go and get themselves boosted up and they have their 5, but when it comes to their 4-year-old, people find it really, really difficult. So what I start off by saying is that the vaccines are safe and effective. And I would never recommend anything for anyone that I wouldn't recommend for my own loved ones. And, people will also say, well, the, side effects and the number of children who have died and have gotten really sick is really low. Is that true? Yes, that's true. However, what if your child was that one child who got really sick? You really have to weigh, would I be okay with withholding the vaccine and accepting it's a decreased likelihood that my healthy child contracts COVID and gets really, really sick from it? Or do I obtain the vaccine knowing that it is, safe and effective? And how do we know this? Because of clinical trials. So is it difficult? It's a difficult decision. It's a personal decision. It's a decision that you have to discuss amongst your family members and your loved ones. But do I recommend it for children? Yes, I do.
Okay, so we have someone from the CHIDIS Summer Youth Institute at Eastern Michigan University.
Hello.
On COVID and flu awareness and other work. And they say, as high school students, what can they do to help spread awareness?
Oh, great question. Let me tell you what has worked the most for me with high school students and younger people, even college students, because they feel invincible. Like, I'm fine, nothing's going to happen, et cetera, et cetera. One of the things that people don't talk about enough with COVID is people think about it like, my nose is going to run and I feel fine and I'll live and no big deal. Or, oh, I can get sick enough and go in the hospital and risk death, but they forget about what happens in between. And one of those things that can happen if you contract COVID is long COVID. Okay, some people call it long COVID, some people call it post-acute sequelae of COVID. If you are a 19-year-old cheerleader, active, you run track, and you contract COVID, and we know that up to 25 to sometimes 50% of, in some studies, of people develop long COVID after having COVID with fatigue, shortness of breath, weakness, et cetera. That's reason enough to get it as well. And that's another reason why I'm going to keep getting my boosters. I've taken care of people with long COVID, and it's been 2 years now, and they still don't feel good. or they're still fatigued, or they have to nap several times a day, or no matter what, they don't have the energy. So that's one of the things that you can do to talk to young people. Like I also, speak at some like sports um, um, arenas and to college football players. All you have to do is tell a college football player, like, hey, there's a possibility that you can be too fatigued to play football, to make them reconsider it. Is the college student likely to die from COVID? Mm-mm. Is it likely to make them really sick enough to go into the hospital? No. But the risk of long COVID is something that deserves, discussing with the community.
Yeah, I think that's an excellent point, because we've been hearing a lot in the learning community about how, well, it's milder now, so why should we still get vaccinated? But, not really thinking about the implications of long COVID.
Exactly. And studies have proven that getting vaccinated and getting boosted decreases your likelihood of decreases the likelihood of you contracting COVID, thus decreasing the likelihood of you contracting long COVID. I know people who are in their 20s and have been short of breath for 2 years now from COVID, or are typically energetic people and just don't have the energy to do a lot of the things that they do, and one of a huge NIH study, one that I am a part of, is studying long COVID so that we can know more about it. But I want people to not develop long COVID in the first place. How does one do that? If getting vaccinated and getting boosted.
So someone asked, do you have any advice for getting community messengers?
Oh, that's not easy. And I wish I had great advice. Like, something else is always think about who in that community is most trusted. And let me tell you who's been wonderful during this pandemic: churches. Very early on, people were like, oh, the church is not going to want to do a lot. That has not been my experience. So reaching out to churches, seeing who do they have, like a health board or community outreach board. You want to reach thousands of Black people, you can do that through church. Also, thinking about consulates, like the Latin American consulate. They do wonderful work in the community. So don't reinvent the wheel. Look for community-based organizations. Many of you are probably involved in them, that are already doing this work out in the community. Community knows them. You're not a new face. Community knows these organizations know how to communicate with, speak in Spanish, speak in educational levels. And some of them may have, community members who are able to join you to get this work out. And, everyone who doesn't have a cell phone, who, no matter what socioeconomic class, who doesn't have a cell phone. So a lot of this information, put it on Facebook, put it in on social media. If you can't get to the person, you can make it to them via social media.
Excellent point. So this one goes back to children. How have adverse effects been on children regarding vaccines? Are they about the same as the adults, or are they different?
Good question. So they're not different. And this is what happens with young people who have great immune systems, remember? So, and they develop robust immune systems. So let's say if I got my booster, which I did get my booster, like my arm was a little sore, but I didn't feel anything else. I didn't have fever, chills, etc. But the younger you are, you have kind of robust immune systems. So you'll find sometimes that young people, college students, children, when they get the vaccine, they may have more achiness, not wanting to play as much. But again, the way I like to think about it is that's your immune system ramping up to get ready for COVID if you're exposed to it. And like in an older person, sometimes they don't develop that robust immune response either. They may have a sore arm and that's about it. So I like people, as you're talking to them about the boosters and as you're talking to them about vaccines, to make it very clear, like don't, some people are like, well, just tell people that it's fine. No, they may feel bad. Yeah, you may feel achy. And like my arm was so sore when I got my first Pfizer shot, I could barely lift it up. But I told my patients that be upfront so that people know what to expect, and just let them know that those symptoms are because of a immune system ramping up, making those antibodies so that when, and I'm not even going to say if, because the vast majority of us are going to be exposed to COVID, especially with these super, infectious and contagious new variants, so that when we're exposed, we have the immunity to, to fight back on that. But, what you hear a lot in the media in just kind of in general is, the one or a few children who develop myocarditis, that scares people, and myocarditis is inflammation around the heart. That scares people, but I like to remind them one of the most common causes of myocarditis is virus infections itself. So you're more likely to get myocarditis from COVID itself rather than the vaccines. But these anecdotes, these, kind of one-off situations, sometimes is enough to kind of scare people from the big picture.
Well, Dr. Riley, thank you so much for sharing your expertise with us this afternoon. I know boosters have been such a hot topic in our learning community, and how to message them, and what the story really is. So we really, really do appreciate you being here today. So if there are no other questions, we will move on to our satisfaction poll. I would love if all attendees took a quick satisfaction poll that will help inform our future events. And while you are doing the satisfaction poll, I want to highlight a couple of upcoming learning community events. Tomorrow, we will be hosting a health equity webinar, and we'll discuss CDC's new health equity guiding principles for inclusive communities. And then on Thursday, we will host the PAVE Quick Talks, where 4 of our PAVE organizations will each give about a 5-minute presentation about the work that they've conducted in year 1 and their plans for year 2. And I will drop the registration links to those 2 events in our chat, so you can register for those. And yes, thank you so much for everyone attending today, and for all of the work that you are doing in the learning community. Let me drop these in the chat. Everyone enjoy the rest of your day.